we really need doctors like you who have a purpose. You, like you said, you've gone through a few things in your own personal life, and that became your purpose to deliver so much. And you've been in this field for a very long time. What have you noticed about the mental health that you feel is very concerning these days? Because I have a daughter, older daughter, and a younger daughter, 16 years old, and she tells me a lot about what's going on in her school. So I'm shocked that kids of her age who are like 16 years old are talking about mental health. So what is very concerning these days about mental health?
Yeah, I mean, there are concerns. At the same time, I should say there's a lot of positive developments as well. If I go back to 20 years ago when I started my psychiatric career, about 22 years ago in the UK, I think I probably would say that India is where UK was 22 years ago in terms of mental health awareness, the services being set up, the accessibility of mental health services, and the treatment options available, and all that. But however, this one, because you asked about the concerns currently, I think the prevalence of mental health, right, is definitely quite high these days. Maybe it's because people are becoming more aware, more insightful into what's not going well in their lives. Like you said, even young kids, people don't believe me when I say that, the youngest kid with a severe obsessive compulsive disorder I've seen is 6 year old.
Oh my.
I don't know if you heard about this condition called OCD. It's a
Yes.
very common condition, obsessive compulsive disorder. And I saw this young girl, 6 year old, very recently in Bangalore, where she had this extreme negative rumination that her dad is going to die. Of course, dad is absolutely healthy and hale, he's doing really well. But it's just an intrusive negative thought which makes her feel it's real and start to impact her functioning. This was noticed by our class teacher when this kid was crying and not focusing on the lessons of the classes. And then she said, "My dad is going to die," and the teacher has to panically, call the father, and he was absolutely fine. So the awareness is going up. When young children and adults, and this more accessible these days, those are good things. But however, the prevalence and the impact is quite huge. From all walks of life, from all age groups.
Oh my,
Yeah.
and here I am concerned that my 16-year-old, why is she talking about mental health and all these things? And you're telling me even 6-year-olds are, going through so much. And I am concerned that why is my daughter telling me there is so much of mental health issues these days, mom, at our age and everything. So now I can relate to that. But I'm very
Mm.
intrigued by what you said. So what comprises of mental health? What all is included in mental health? When we say, oh, you need to take care of your mental health, or we say, oh, these
Yeah.
people have mental health issues, what are we talking about here?
Well, it's a very interesting question because it's very important for us to understand what comprises of mental health or mental well-being, even before we try and understand what can go wrong or what can constitute as mental illness, right? I think when we talk about mental well-being, we talk about some kind of equilibrium in the way we think, the way we feel, and the way we behave, right? So whether we like it or not, the way we function or the way we behave on a daily basis or the way we relate to people, right? It's influenced by how we think and feel. So basically, we are driven by a set of emotions and thoughts that keep running through our mind every day. As long as they are, kind of quite positive and going in the right direction, of course, our behavior and functioning and the way we relate to people will also be positive. But if something changes in the way we think and feel, and we can talk about the causes and why it changes and everything, right? And it immediately starts affecting the way we look at things, the way we function and behave, and all that. So there'll be a lot of dysfunction, that results in the way people take care of themselves. To begin with, at a very personal level, there'll be a lot of impact, right? When and the dysfunction is there in thinking and feeling, and of course in the family, in the relationships, and the occupational impact, the social impact, and so on. So if the equilibrium is lost, right, in the way we think and feel, then the impact could be so much so that it may result in what we call mental illnesses. Of course, we categorize them just for a better understanding of what should be done and how this impacts a person, what treatment should be offered, and things like that.
Hmm. So, like you said, Kid, there are people who behave differently and then they think differently. What makes certain people behave differently? See, I am a very big advocate of mental health myself. For me, I feel that, your mental health has to be consciously taken care of. You just can't sit back and relax and say, oh, it's going to be fine. Then everyday work, which even I do for myself. So I can really relate to what you're saying. But you being a doctor would be able to explain this much better. Why is it that some people are able to behave in a particular way positively, and we feel, oh, they have a very strong mental health, and the others we feel don't? What is the reason behind that?
Yeah, absolutely. Look, the way I would explain this is, I'm sure we are all aware of the IQ, right? The
Yeah,
intelligent quotient,
yeah,
how we are all different from one another in terms of what's our intellect levels, our problem solving skills, and everything, right? Similarly, we do have that emotional quotient, right? The
right.
emotional intelligence, we call it. Now, even before we come to that, right? We need to really understand that each one of us have a different personality, right? Different personality, and each personality will have their own strengths and their own limitations. All of us will have some strengths and some limitations, and all our strengths and limitations are totally different to one another. The question you were asking, why we are all different in the way we think and behave and all that, right? And if you look at these personality traits and the strengths and limitations being different to one another, it's primarily because of various underlying factors. It includes the genetic factors. For example, some of the hereditary characteristics we carry from our parents and our families, and then comes the upbringing, then the experiences you go through. You may have gone through some good and some not so good experiences. All these factors put together, the genetics, the upbringing, the experiences, and the environmental factors, is what shapes our personality. Since all those factors are completely different to one another, we all end up with different personalities, different way we think, feel, and behave. So it's important as a psychiatrist for me to understand each individual in the context of what they're being through.
Mm,
For example, if two people present with depression, clinical depression, right, I can't treat both of them in a similar way because both have a completely different context. It's not like if two people come to a doctor with appendicitis, you may give the same painkillers and same antibiotics, but mental health field doesn't work like that. So I think we have to really understand the personality context, the background factors before we decide on what treatment would work this person. So yeah, that's very interesting and can be challenging also.
yeah, no, because I deal with people every day as an executive coach. Work is to deal with people, throughout the world. And I always believe that we all come with our own blueprint, like you said, an experience, an environment in which we are. So we call it as a blueprint. And then you
Yes.
said that there are different personalities. Now, these different personalities come into the corporate world also, right?
Yes.
Like when we're talking about that, how our mental health impacts our success. So every day, this personality. So we know of people who have a bipolar. We know people who are narcissist in their behaviors, right? We know people who have challenging, mental abilities to think straight. So now all of these people are coming into the workforce, right? So
Yes.
how is this impacting our work now?
Yeah, absolutely. Look, just like we talked about the impact the mental, well-being or mental illness can have people at various paradigms. So of course, workplace also becomes an extremely important part, right? So, just I have some statistics here. Just want to share before we talk about the
Yes.
impact. So particularly in the corporate world, what the World Health Organization has noticed is currently we're having about really 12 billion work days lost every year,
Wow.
right?
Well,
12 billion. And sorry,
my God, that's a
yeah,
lot.
and also in terms of productivity, in the productivity of people, we are almost close to about losing about 2 trillion US dollars every single year. And they anticipate that it's going to be around 6 trillion US dollars lost per year only because of mental health issues. And it's one of the major cause of disabilities in young people. Mental health amounts to as much as 45% of overall burden of diseases these days. So it's becoming unimaginable for various reasons. And of course, in a corporate world, apart from the individual personality factors which we spoke about earlier, and all the background, the hereditary genetic factors and things like that, people are getting into an environment where the workplace organization culture, the dynamics between people, leadership styles there, not accounting for the diversity people come with, all those social support available, all those factors do contribute to individual mental health. So of course, the awareness and the recognition may be very poor. Only when it starts to have an impact on somebody's functioning, then the eyes will open. Things are changing though. I can give an example of a recently as an IT professional. I shared with a lot of media people. It was there in the newspaper. He's just a 28-year-old gentleman, right? It's a very interesting presentation he came with. His presentation was he came into my clinic and he's with his mother, and his mother shared with me that he takes bath for about 10 hours every day.
10 hours?
10 hours
God.
every single day, and he wakes up at 3 o'clock, has bath till about 9 a.m., then goes to work, comes back about 6 p.m., and then goes straight to the bathroom, takes bath until about 10 p.m., then sleeps. That's been his lifestyle for almost 7 to 8 months before he came to see me.
My God.
Right, so he had a severe obsessive compulsive disorder again, where there's a lot of irrational thoughts that his body is contaminated and he needs to keep washing it as a compulsion, and he got into this trap and it was doing it again and again, so much so that his wife had left him, because he was either in work or in
Yeah.
bathroom all the time, right? So and so many impact, and mother was going through depression looking at him. So I have lots of these corporate people coming with, recently I saw another case where this young, middle level manager in a corporate company, again, his company people brought him to the clinic mainly because he suddenly fainted and started speaking like a 6-year-old child. And this was completely bizarre for all of them. There's someone who's very intellect and participates in all the discussion very, very well, and suddenly talks like a child. And this phenomena we discovered, it's a more what we call a dissociative disorder, wherein the conscious mind dissociates from reality.
Yeah. Yeah.
The reality is so painful. Whatever he was stress he was going through at workplace had led him to this dissociation. So clearly in the corporate also, just like you and me, they're also human beings, but yes, the culture and the vulnerabilities within them has resulted in significant mental health issues.
My
That's
God.
what I
And this is all impacting the work, the productivity, the way we think, make decisions, a lot of that. And we
absolutely.
don't realize that how much our mental, we work hard, we think we need those credentials and the skills, but we don't realize. And in fact, a lot of my work comes from what you're saying, that leadership is an inside game first that you need to play, and then you'll get
Absolutely.
the results. So I can really resonate so much with you. Dr. Satish, you spoke about sleep disorder.
Yeah.
Can you tell us a little bit about more about sleep disorders, because that is going around so much. I know executives who are not able to sleep at night. They are sleeping at 1 o'clock, 2 o'clock, waking up at 4:30. What is sleep disorder?
Yeah, sleep disorder in itself has not been recognized as a specialty, until recently, I should say, So, yes, to understand sleep disorders, first of all, we should recognize that, the activity sleep in itself is a very complex psychophysiological phenomena. There are multiple factors involved for you to sleep peacefully and then having a good night sound sleep, right? It could be your work related stress, it could be your personality aspects, it could be physiological factors and so on. So sleeping in the night, right, we go through what we call sleep cycles. There's a
Yeah.
sequence of physiological activities that we go through, and it has to be that way. A lot of people don't, have very little understanding of this fact that they'll try to catch up on their sleep whenever they want.
Yeah.
Very erratic patterns. They claim that they have 7 8 hours of sleep in different bits and pieces, but it doesn't work that way. So when there are multiple factors, right? One is the understanding about how much sleep you need, right? So from a newborn baby who can sleep for about 20 to 24 hours, 20 to 22 hours in a day, the day one, and as we grow older and older, our sleep duration keeps coming down.
Yeah.
And an elderly person, maybe 80 plus age, may sleep only for 5 hours, 6 hours. Could be normal. That's one understanding. Second thing is obviously, people who cannot sleep well, that insomnia we call it, right?
Yeah.
Either they can't get into sleep, that initial insomnia we call it, that they sleep but it's very broken in nature, or they wake up in the morning, early morning, or they wake up normally but they don't feel fresh. All four is considered as insomnia, right? Again, these people, 70 to 80% of people with insomnia have some or the other psychological cause, right? And again, the psychological cause need not be like a major anxiety and depression. It could be something very minor, stress they're dealing with, work-related issues, family-related issues, or sometimes there's something called sleep-related anxiety. I see lots and lots of people, particularly working age population, with sleep related anxiety. So basically
What does
what it
that
means is,
mean?
yeah, so just it starts with them losing couple of days sleep, right? For whatever reason, like we all go through, right? Couple of days sleep, the traveling or whatever, you can't sleep for a couple of nights, and then the anxiety kicks in. Oh my God, I'm not sleeping well. What if I can't sleep tonight as well? How will I manage the
Yeah.
following day? Particularly in some sensitive people who are a little neurotic in nature,
Hmm.
that anxiety is so much so that sleep starts to decline further. So it's like the anxiety goes up and the sleep comes down, and as the sleep starts to come down, the anxiety goes up further. So they get trapped in this cycle of more anxiety and less sleep, right? And I see a lot of people, particularly in the corporate world also, we talk about all these smart watches and actigraphies, which monitor the sleep and everything, right? Yes, it's a great thing to understand your sleep quality, quantity, REM, NREM, and all that, right? But for somebody who is very sensitive, very anxious in nature, right, it's very counterproductive. I have seen in my clinic people coming to me and telling me, doctor, I'm just having 18% of NREM2 stage sleep, where the literature says I should have 25%. So they get into so much details which may not be helpful. So yeah, I mean that besides, people can have, since you asked about sleep disorders, right? Apart from insomnia, there's something called hypersomnia as well, where people sleep more. Again, that can happen in clinical depression or many other clinical conditions, metabolic issues and things like that. Parasomnia is another condition, which is basically some abnormal activity or experience or behavior happens in the night. Like you heard about sleep talking, sleepwalking, nightmares, night terrors, teeth grinding, restless legs, and so on. And of course, you heard about the circadian rhythm disorders, people who have
Yeah.
very erratic sleep patterns, environmental causes, sleep state misperception. So there are many, many sleep disorders we have discovered. I think it's very interesting to understand the patterns of sleep difficulties and the underlying causes and how we go about treating them. So a lot of evidence and research has come up to have a better understanding of sleep disorders and also the treatment aspect as well.
Yeah, because we don't think about sleep disorders, right? We think that, we are tired in the morning, we're not able to go to work, and all this is impacting, like you said, 12 million days lost due to all of this.
Yeah.
No, I mean, we are not counting that because we feel that, oh, the employee is just tired, but the root cause is so much different. And then you also spoke about anxiety and stress. How does these days there's a lot of increase in the levels of stress and anxiety,
Yeah.
and I'm sure you've seen it, right? So, number one, I
Mhm.
would like to know what's causing this increase, and number two, how is it impacting our daily life, which
Yeah.
we are unconscious about it.
Yes. No, absolutely. Look, earlier we spoke about how each one of us have different personality traits and the strengths and limitations, right? Because, and I also mentioned earlier that, if two people are, experiencing anxiety or depression, both could have completely different cause, different manifestations, and how we treat them, differently as well. That's because, those individual personality traits, when they are different, it's lying there somewhere, the strengths and limitations. But something gets triggered in the external space. We speak about stress, right? Stress is very subjective and very, it's also about perception, right? So the stress, something stressful to you need not be stressful for me,
Okay,
right?
yeah.
It also depends on the
Yeah.
person's resilience, their coping skills, personality trait, and so on. But in somebody who is already very vulnerable, something external happens. It could be personal level or some job related, career, relationships, financial, anything, right? It could be something very small also. I've seen people, extremely minor trigger can lead to a severe depression episode as well. So when those triggers, surface, the person's vulnerabilities get exposed. Of course, there will be some neurochemical changes in the brain at that time. So, even now, as we speak, as we have different emotional experiences and expressions, there are a lot of neurochemicals like serotonin, dopamine, and noradrenaline at play. And this happens automatically. We don't need to worry about it. But in people with depression and anxiety, when their vulnerability gets exposed, there are certain chemical irregularities in the brain, which leads to them experiencing a lot of what we call negative automatic thoughts,
Hmm.
which means they are negative and they're automatic, which means they are not like sitting and choosing to be negative. Because of those chemical changes, automatically a lot of negative thoughts will start popping up. Now the challenge is when these negative thoughts start popping up in the mind, it seems so real to the person. In reality, how much of them are true or not, it's a different question. But for that person at that moment, it seems so real. It starts to affect their emotions, their behavior, sometimes even biological function in a way that they become withdrawn, dull, very anxious. You spoke about the anxiety, right? The anxiety basically means irrational fear. So
Mm.
irrational fear could be about anything. It could be for everything when we call it generalized anxiety disorder. It could be about some specific things when we call it phobic anxiety. It could be about some trauma they experienced in the past. We call it PTSD, post-traumatic stress disorder. It could be obsessionality, where some irrational thoughts lead to a lot of anxiety and fear. We call it OCD. So, and clinical depression is person becoming withdrawn, dull, not able to enjoy what they used to enjoy. Interest, motivation going down, and so they also get into a lot of negative ruminations about life, suicidality, and things like that. Not sleeping well, not eating well, and getting trapped in this cycle. So the manifestations of anxiety and depression could be different types in different people, depending on the vulnerability and the trigger we spoke about. So not all stress leads to anxiety and depression because of some of the factors we discussed earlier, the person's vulnerability and the resilience and all that. But what do we call a clinical depression anxiety? When does a mental health professional should get involved? Is only when it's not just the presence of symptoms, it's also about the severity and the duration, and lastly the impact. When it starts to have an impact on the person's functioning, in the day, including
Day-to-day
their
life.
self, absolutely day-to-day self-care, sleep, or occupation, social aspects, academic aspects, whatever they are into, right? That's when we need to intervene and start to look at how can we help the person in a very holistic way.
So at Sukoon, you are working with these patients, you are making sure that they are treated, right? In your experience, with so much experience that you have, what are some of the ways we should begin to take care of our mental health?
Yeah. So yeah, absolutely. I think some of the preventative things we should do, right? First of all, number one, let's accept that this is real. Mental health conditions are real. I think we should accept it. Many of the times we go into the denial, that including myself, right? I'm a human being first. And I tell my patients also, look, I'm a human being first, and nobody's immune for mental illnesses. We don't know when it strikes, right? Because we don't know our vulnerability. You may be happy with what you're doing, what you have today, but you never know, right? About yourself or your family members and things like that. First, let's understand more. Let's become more aware about how that equilibrium of thinking, feeling, behavior is in place, and how it can get a little dysfunctional when something doesn't go well in our lives, and the various impact it can have. So, of course, you'll start to see the manifestations of the person, of the individual, and the family, and all that, right? So, in terms of what to do and how to take care, the first thing is, I would say, is you start to become very mindful of what you go through in your mind. I'm sure everyone has heard about the mindfulness techniques we talk about, right? Just to become aware, just watch your thoughts, watch your feelings, see they may be good, they may be bad, they may be positive, negative. We don't know. Like many thoughts and emotions are automatic. We just let's be aware and become aware and just be present to that. A lot of people are aware, right, what they should do to maintain their mental health, in terms of their regular exercise and yoga, the meditations, sleep hygiene, healthy eating. And I think these are things people are aware. So what I spoke about was at a much more cognitive level, what we need to do to take care of our mental health.
No, I think this is so imperative what you spoke, because we usually don't think about these things, we miss these things. But when we're speaking about mental health and we're speaking about, success and how, and like you said, how it is impacting our productivity, our day-to-day work, in your experience with so many patients that you see from children all the way to adults, what is that one thing that you feel that if, people suffer the most when it comes to mental health? Because see, mental health, please correct me if I'm wrong, also impacts your body. So we say that
Absolutely.
whatever diseases you have is caused by what your thinking process is like, right?
Absolutely.
So many diseases are cured based on the mental health, and so many diseases we get because of the mental health. It's both ways, right? So, what is that one very crucial thing you feel when you have seen your patients and you've thought to yourself, if only they did this, they would have been so fine?
Yeah, absolutely. I think the main thing is, accepting that I have that vulnerability, and it's okay for me to feel down or feel nervous or feel anxious, feel fearful. Sometimes in my life, I think that little acceptance of that vulnerability and being okay with that, is can lead to a lot of resolution, right? A lot of people keep fighting with their vulnerability. They don't want to experience what they're experiencing, but unfortunately, whether we like it or not, emotions are like flowing river. Sometimes a river can be very clear, sometimes it can be muddy. You can't do much about it. All you need to do is just sit and watch it and see if you're okay with this, right?
A lot of
I think
people
that's
are not,
one.
right? Dr.
A lot
Satish,
of
I've
people
seen
are
so
not.
many people, they are not able to recognize their own emotions. They don't know what they are going through. They are going to the
Absolutely.
highs and lows, their mood is off for days, but they absolutely don't know what emotions they are going through.
Absolutely. And like I said, they start fighting with their emotions. So they want to quickly feel better. They don't want to experience negative emotion. They don't want negative thought. They don't want conflict with people. They want everything to be aligned. Look, that's a wishful thinking. Yes, we all want that, but the reality is, things are not always going to be the way we want. But if you are going to be okay with that and just have that resilience and confidence to deal with them, yes, it may be a little discomforting, then accept the discomfort as well, and just over a period of time you'll definitely develop that skill and master it, right? If you're able to just be with it. I think that's one skill people learn of being mindful. I think it'll definitely help them prevent getting into any sort of serious mental health problems.
So nice. So you've given us so many nuggets. One last question. What would be your advice to people who want to succeed in their life?
Yeah, look, we always talk about how stress is related to our performance, right? So in terms of people talk about stress, I have a lot of stress in my life, and it's clearly impacting my academics. I can't get a job, and I can't perform well in my functioning and all that. Look, if you really want to be successful and happy, I think it's important you see things in the context of what you are as a personality, your vulnerability, and the fact that your vulnerability does manifest negatively at times in your life. So it's not always that stress, higher the stress, the performance will keep coming down many a times, and the stress can be very helpful. So can you take it on your on your stride as a positive thing, and just to take it as an opportunity and be successful. I think for me it's about being aware of your vulnerability, and number two, can you be consistent with what you do,
Hmm.
right? Irrespective of what the emotional changes are. When I say consistency, it's not just about the work. I'm talking about even the relationship, for example. Many times things can go wrong in the relationships as well with the loved ones, children or spouses. So can you just take a step back and say, look, can I just appreciate what this person said? Yes, I'm totally not in agreement with what he or she said, but can I just appreciate, right? Just putting yourself in their shoes and appreciate that for a moment and not react to that will definitely help us develop a lot of insight and resolve things. So yeah, I mean, I think people can be mindful, and people continue to be appreciative of others emotions will certainly help to manage any stresses they want. And the consistency in action will definitely lead you to success. Yeah, sometimes the pace at which the success happens may vary, but it's bound to happen if you are consistent with it while you manage your emotions.
Absolutely. Thank you so much, Dr. Satish. You have taken the time to come on the podcast and share so much of your valuable insights. I mean, you are a powerhouse of knowledge on this. So I'm really honored to have come on this podcast. Thank you so much.
It's been a great pleasure talking to Payal. Thank you so much. Thank you for the opportunity.
Thank you.
Thank
And
you.
this one's for our listeners. This is Dr. Satish Ramya and Payal Nanjiani wishing you loads of success in your career life. Thank you and God bless.